So we're going to ask Pastor Roxy of the First Christian Church to lead us in welcome and faith grounding.
Good evening.
Good evening.
I'm so glad you were able to join us for this gathering this evening. Nice to see so many folks turn out for this. We're glad the word got around and everyone heard was able to come. Those who might have been here earlier this evening know that from our community table, which we offer here every Monday evening, a free meal every Monday evening, that supporting community is very important for First Christian Church. During the pandemic, when we were forced to close our doors for the community table, I would often see some of our regulars out in town, around, and people would say, "When are you going to start the meals again?" And I'd say, "Well, I'm sorry, I just don't know." And what I heard time and time again was, it's not because there's not enough food in town, but we really miss community. And that's what is so important to all of us, right? Is community. Is what we are created for. We are the multifaceted creatures, right? We are physical, mental, and spiritual. And each of these facets works best when each of the facets is at their best. If you're not eating well, then sometimes we can't even think straight, right? When our mental capabilities are strained, then that often shows up in our spiritual life. And if we're not grounded spiritually, then we tend to not take good care of ourselves physically or mentally. So in the same way, we are created to be relational beings as well, right? We need each other. And the truth of the matter is, we all do well when we all do better, right? We're better together. So I'm glad that you are here tonight for this. I hope you will be willing to share openly with one another. I want to remind you that what we are creating here tonight is a safe space. A space where we listen with compassion and without judgment. A place where we intend our stories to move our community forward into understanding, forward into caring, forward to more and better resources as we come to recognize the needs of our community. There is comfort and consideration in shared stories, knowing we are not alone in our feelings of loneliness or despair, in feelings of caring or concern, or in feelings of hope or joy. All of this is helped when we understand that others are feeling what we are feeling. It helps to build community when we know we're not alone. So no matter how different we may seem, we have more in common than we have that is different among us. So tonight is a time for us to focus on those commonalities for the better of our community. Would you pray with me? Oh, Creator, God, that which sees us and knows us and hears us, we ask you to be present in a way here that keeps us open and seeing and being present to one another. Help us to have hearts that are open, ears that are open, and minds that are open, so that we may receive one another with full grace and dignity. Bless our time here together, that we may, at the end of this evening, find we are more community than ever. We give you thanks for your presence in each of those gathered here. We speak this in all your holy names. Amen.
Thanks very much. I'm Jenny Fluer, a member of Hoosier Action, a resident of Martinsville, and a licensed clinical social worker.
I'm Chuck Frawley, a resident of Martinsville, Morgan County. Lived here in town for about 15 years, live out in the woods between Paragon and Emmons. And I am here as a member of Hoosier Action because we're all part of one community here.
Hoosier Action is a statewide, member-led, nonpartisan community organization. Our members decide, shape, and execute the work we do. Each of our chapters are local people focused on issues that impact their community. Our Morgan County chapter is a group of community members across Morgan County who are committed to making our community a place where we can all thrive and have our voices heard. In this room tonight, we have local elected officials, first responders, service providers, impacted people, veterans, community members from across Morgan County that are invested in the health and well-being of its people.
Why are we here tonight? We had chosen to focus on mental health after knocking on doors, talking with people around town. And all this summer, every time that we knocked on the door, we heard a story about mental distress, problems with drugs, problems with people who didn't know where to go to get help. And these issues seem to us like something that had to be addressed by finding a better way for these people to know where to reach out and to have someone there to help them. We've heard over and over that the nation is in a mental health crisis. And we don't just see this on TV with talking heads telling us. We look around and we see our neighbors. And we see that there are problems that are bigger than any individual is equipped to face on their own. We're here to focus on solutions. We're not here to give you solutions. We don't have any. We're here to talk about some possible solutions that have come up, and I don't have a clicker. This isn't my day job. My day job is a dog walker. But this is one possible solution that we'll talk a little bit more about later, has been presented by a task force chaired by the chief of our Supreme Court with a large panel that I'll talk about later. But this is one of the models that they are proposing, and Senator Bray later will tell us some more about that as well. The main reason we are here tonight and every night that we meet is that we value the life and dignity of every member of the community. Once again, we're not here to prescribe solutions, just without a set of ideas, because whatever happens over the next months and years is going to be a Morgan County solution. It's going to be shaped by the people who live in Morgan County, whose families are here, whose responsibilities are here, and who understand the needs of their community and are willing to work together and do something about it.
We know that this issue is really close to home for a lot of people in this room. We want to create a space that honors our personal experiences and struggles, and is also centered on finding solutions together. I want you to turn to your neighbor and share with one another the reason why you're here tonight and why this topic on mental health and substance use is important to you. I'm going to give you about 5 minutes to share, and then we'll come back together. All right, please raise your hand if your neighbor had a similar reason for coming here tonight. Raise your hand if you've heard something that struck a chord with you. I'm sorry, Henry.
I said we can't hear you.
You can't hear me?
Nope.
Okay. I asked everybody, keep the mic. Okay. I asked everybody to raise their hands if you had similar reasons for coming here tonight. And then, yeah. And then I asked everybody to raise their hand you heard something that struck a chord with you.
If you heard something.
All right, thank you for sharing. Now we're going to introduce Chuck, Bridget, and Tasha. They're going to share with us information on the problem we're facing in Morgan County and describe a solution.
Okay. All right. My name is Bridget. I'm one of the many who have what's called a dual diagnosis. I have mental illnesses and substance use disorder. I've been hospitalized 4 times for substance use and 3 times for mental illness crisis. My story begins in a house of addiction. Both of my parents were addicts. My life took a sharp turn at 12 when my mom died from an overdose. My dad took me to many therapists off and on throughout my teenage years. But it was not until well into my adulthood that I was properly diagnosed. In my early 20s, I started to develop significant back pain. My doctors prescribed opiates without question. It was not until about 6 years later I was diagnosed with degenerative disc disorder, but by then I was already addicted. The prescribed medication soon was not enough to take care of the pain, so my addiction progressed to heroin. 2 years later, I had back surgery that alleviated the pain, but by then I was a full-blown heroin addict. It was not long before I started seeking something to pep me up because I didn't like the down effects of the heroin. I was introduced to meth about 3 years into what I now know as my active addiction. It didn't take long before I was using both heroin and meth in the same syringe. My life was spiraling out of control, and I had no clue how to stop it. I sought help long before I got the help I needed. I had lost everything: my home, jobs, my family, my self-respect. Since I could not keep a job, I had to find other ways to fund my ever-growing drug habit, so I started stealing from stores to trade for drugs. I was arrested 6 times in 3 years, and now I'm a 4-time felon. The last time I was in jail, I decided enough was enough, and I was going to really change my life this time. I knew I had to change my people, places, and things to succeed. So the day I got out, I went straight to the Magdalene House for the night. The next morning, I was on a bus headed west to change my start. I landed in Phoenix, Arizona, with only a few dollars in my pocket and a suitcase containing everything I owned. I went to the hospital seeking help, but got nothing but discharge papers. I was lost, scared, and had no idea what to do. I climbed into a taxi, with tears running down my face, and told the driver I had no destination. He told me he knew right where to take me, and off we went. He took me to a place called Community Bridges Incorporated, and he said I would be safe there and I would find the help I would need it. Once inside, I waited a few hours, but then was given a bed, something to eat, and told to get some rest. Within 48 hours of arriving, I was evaluated by a therapist and assigned a caseworker. The caseworker got me set up with insurance. I promised to pay halfway house and a mental health appointment the following week. She followed up about a month later with me to make sure everything was going well. And that was over 2 years ago. And today I stand before you 27 months clean due to proper crisis management and adequate resources provided at the right time.
Good.
Thank you. So, as we know, painful experiences and healing actions both create ripples in our community that impact each of us in many different ways. We're going to talk about what is happening in our community and the ways in which we are each impacted by mental health needs and substance use.
Can y'all hear me? My name is Tasha. I'm the Morgan County organizer and organizing director with Hoosier Action. I am somebody who has battled with depression on and off my entire life. My family struggled to pay the bills when I was a child. In 2008, our house was foreclosed on. And I remember struggling before that, but when that happened, things felt heavier and harder, and continued to feel heavier and harder. My mom coped with alcohol, and my dad coped with gambling. And when I was 16, I dropped out of high school.
because I had a year of not being able to get out of bed and feeling like I had no direction. And since then, I've lost friends to overdoses. I have seen many friends and family struggle, and I have been in many situations where there is a crisis that is happening, and I don't know who to call. And I have to deal with it without training, without tools. So I'm going to talk a little bit about what we're seeing, what's happening in our communities. So do you want to go to the next slide? So I'm just going to start with this. A little bit of the context of the water we're seeing right now. People in Indiana are struggling. It's not just Indiana, but I'm going to stick to Indiana because that's where we live. So, what we see is that Indiana's maternal mortality rate is one of the worst in the country, and it's gone from bad to worse in recent years through the pandemic. We see a state where there are many renters. Many renters are cost burdened. So we have 27% of renter households are extremely low income, and 72% of extremely low income renter households have severe cost burden. So many people are cost burdened from our housing situation. We're also seeing that a lot of you are really feeling it. Probably feeling some of these things, but inflation increases have made simple things like gas and rent and milk and eggs hard for many of us to afford. And this is big. And it's not because there's not enough. So across this is, I don't know if I need to read this, but I'll say the 20% of people earning the most in our state are earning an average of almost $200,000 a year, while the 20% of people who are earning the least are living on an average of $13,000 a year. It's not because there's not enough, but things are not distributed in a way that really supports our families. So you can look like the next one. So everyone, what are we talking about? Poverty and financial material struggle in a mental health forum. And it's because they're inextricably linked. And we can debate all day about what comes first, but I will say from experience, if you're struggling to pay the bills, it is a burden to your mental health. And if you experience a mental health crisis, you're more likely to lose your job and struggle to pay the bills. So, families not having support leads to mental health crisis, and mental health crisis leads to people not having the things that they need in their life to be happy and healthy. Okay. And this happens to all of us. It happens to people across gender, across race. It happens to people in rural communities like this and people in urban communities. But we're all impacted by it. So I just wanted to name this a little bit. I think we are all hit by this, and some people are hit harder than others. So marginalized people across race who live in poverty are more likely to experience severe mental health issues. So I have just like a couple examples here. LGBTQ youth are 6 times more likely to report being severely depressed and 8 times more likely to have attempted suicide. People in rural areas are less likely to have access to services, and cost is likely to be higher. And then people of color are more likely to live in high poverty areas and more likely to experience mental health difficulties. This is you. Go on.
Okay. told you I'm Chuck Frolick. Been a resident here since 1989. I come from up farther in central Indiana, up in Henry County. Grew up in a little town, out on a farm outside of a little town called Spiceland. Like most members of my generation, I grew up in a community where mental health was not openly acknowledged or frankly discussed, even though the effects of it were all around us. Fathers returned from World War II and buried pain and trauma in alcohol, punched holes in walls, which I saw happen during sleepovers with my friends. And I had an uncle who, at the end of World War II, was one of those who liberated the concentration camps and was troubled the entire rest of his life. There was quite a disdain for those who had difficulties. Problems that we would now see as depression, bipolar disorder, or a whole range of conditions that didn't even have names at that time. Nearly 50 years ago, I lost a close friend who decided it would take too long to drink himself to death. At 38, did a better job. In just my biological and extended family, I've seen many struggle with mental health disorders, have lost others to self-harm, seen a nephew go to prison because of the crime necessary to support his habit, had another overdose and be brought back from the dead twice before the third rehab program in a faith-based program in Tennessee put him back to being a productive member of society and on his way to be an underwater welder of all things. This issue matters to me because, openly recognized or not, these problems have surrounded me for my entire life. And my mental health hasn't always been the best. But I can only hope that we can find a way to work together in honor of those that I have lost and those I've seen damaged during this lifetime. In Morgan County, nearly 1 in 6 adults have reported frequent mental distress, with approximately every 6 days reported as mentally unhealthy. So almost a week out of every month, individuals lose to being in distress mentally. Morgan County's rate of intentional self-harm is nearly twice that of our state, while in the first quarter of this year alone, we had 6 deaths result from overdose. 2 statistics about our county stand out here. Residents have fewer providers per capita for both primary care, in which we have 63% as much coverage as people in the rest of the state, and mental health, where we have 38% of the coverage, with a lot more people. And the state itself is far below the national averages in all of these areas as well. Our first responders are dealing with 400 mental or emotional calls a year, according to one estimate in a study, or about 32 a month. Also, it's estimated that 60 to 70% of the jail population is dealing with mental health or substance use problems. The sheer number of our state's inmates suffering from one or both of these problems often makes jail a de facto detox center in the first place that many people receive their first mental health care. Also, suicide is the second leading cause of death for ages 25 to 34 in Indiana. And Bridget, if you could introduce
This is a basic idea of one of the possibilities that we could possibly bring to this county. A model like this is what I came across in Phoenix, to where we have the proper people at the right time with the right knowledge to provide proper care. So with that.
I didn't think sure it sounds.
That's okay. We're going to take 5 minutes, turn to your tables, and after sharing Chuck's story, Bridget's story, going through a set of slides, love for you all to take just 5 minutes and share with your tables. How do you see this coming up in your community? How do you see this in your lives? And what's so important for you?
But that don't work with David. You can't put him in the house by himself. He's not going to be capable of So, and there's a few other dentists that but that dentist that yeah, I've seen one or two people that is happening. He's another one to be in a
If we could hold the microphone close enough later. But first, I'd like to hear from some of the people in the community that are on the front lines of this, who deal every day with the kinds of things I'm talking about, and can give us a perspective of the program, the problem that you really can't hear from me. First off, we have Jacobston Swafford and Shelley Duggar from the Centerstone facility and the Magdalene House, respectively. Let you guys
Go first. Thanks. So I'm Jacobston. I'm a Centerstone. So I'm Jacobston with Centerstone. I'm a recovery coach facilitator. I'm sure. Does it come closer to me?
Speak to the back of the room. Talk to us.
I'd probably be louder if I just yelled.
Go ahead.
Is that better? Okay. So I'm with Centerstone. I am a recovery coach and a group facilitator. So I think we really all have the same goal in mind here. But I think we all have like plans, but we're just not partnering together like the way we should be as a community. And I understand like there's been, I don't sugarcoat anything. Centerstone has not always had the best reputation here in town. I can proudly say now that over the last couple of years, we have a whole new team who just pours their heart to what we do. And so we're creating and reaching out all the time. We are actually heavily involved with the 988 program. We have a new behavior specialist. She is getting up and rolling right now. So Michaela is going to be Morgan County's primary mobile crisis specialist. She's more going to be coordinated care. That after the first of the year, we are planning on incorporating a couple of more. Essentially, leaning more towards 24/7 staffing. Right now, we do have a diversion center in Bloomington.
called Stride. We have another one opening up in Columbus. That's, the goal is to avoid hospitalization in jail. And I think it's that we have all of these great ideas. Let's just work together to build on them and grow them. I don't do well with public speaking, so I'm going to lead with that. I'm going to let Michaela introduce herself so everybody can welcome her to our nice little club.
So, as she said, my name is Michaela. I am going to be the Cold Care Crisis Specialist in Morgan, also in Montgomery County, mainly Morgan. I'm really new. I didn't expect to come here tonight, so I haven't really anything prepared, but I have done today is my start of 3 weeks of training. I'm going to be in training all next week as well, so as soon as I get some training in my belt, I'll be out doing helping the communities all over Morgan. Things down so I don't get sidetracked. I tend to go off to the left a lot. I'm limited on time tonight. My name is Kelly Duggar. As they mentioned, I'd like to say thank you to Hoosier Action for inviting us here. You can't hear me? Is that better? Yeah. Okay. Okay, yeah, I can probably thought she said just pop up. Yeah. My name is Kelly Duggar. I'm the administrator for Magdalene House, and I really want to thank Tasha and Hoosier Action for getting us all together. I think this is really important for us to put faces with emails. We'll start there, and just to kind of understand what we're dealing with and what we all have to offer. Our mission at Magdalene House and Stability First is to support women as they heal from a variety of traumas. Many of those we serve live with co-occurring disorders. Stabilization and healing can only occur with evidence-based, integrated, and wraparound care. This type of care is only available when we all work together to support each individual as their needs are being addressed. It is the goal of Stability First to collaborate with all of our community partners to provide the support needed when it's needed. We all have our niche, the area that we have expertise in. We don't need to recreate the wheel. We can make significant changes in the services we all offer by listening and sharing ideas. As human service providers, our goal is the same: to improve the lives of the people that we serve. There are several gaps. When I met with Tasha, she asked me about gaps in care that we were seeing. And there are several gaps in the integrated care model that I've seen and we experience at Magdalene House on a regular basis. The gaps we're seeing repeatedly are, and I'm sure I'm preaching to the choir here, but a shortage of mental health providers, and due to this, slower engagement in mental health services. A divide between first response, criminal justice, and service provider organizations, which often sees those with co-occurring disorders incarcerated. Transportation, especially when participants need to travel outside of Martinsville. Delays in medication refills, often creating difficult side effects and return to devastating symptoms. Finally, stigma. Individuals who struggle with any number of social concerns are often stigmatized by peers, the community, and the professionals who serve them. Stigma frequently creates an apprehensive, even threatening environment for those seeking care. According to SAMHSA, integrated care or wraparound services can improve outcomes and quality of life for people with co-occurring disorders, and this includes, but not limited to, improvement in psychiatric symptoms and functioning, improved quality of life, decreased hospitalization, reduced medication interactions, increased housing stability, reduced incarceration, and reduced recidivism. Only by working together are we able to offer those we serve an opportunity for stabilization and improve the quality of their life. Thank you.
I would like to have a representative from the first responders to speak here. Steve Lyman. Health preparedness and response coordinator.
I have been told that I don't need a mic, and everybody back there in the back, outstanding. My kids tell me all the time that the neighborhood has no problem hearing me. That being said, my role is emergency preparedness response coordinator with the health department. As of this year, I've been celebrating 30 years of public safety. I come from a long line of police officers. I have children that are public safety officers and law enforcement and EMP. So first responders is kind of a passion of mine. In those 30 years, I have lost friends due to mental health. Our first responders are often overlooked. They're the ones you call when you have a crisis. No one stops to think about them being a crisis. That being said, there's very little services for them to get help for these kind of problems. My partner and I, which she'll be able to talk a little bit later, have worked with the IU School of Public Health, trying to put a program together for our first responders to have resources to get help. It's a very delicate practice. First responders don't admit they have the weakness. A couple reasons: peer pressure. Second of all, they're fearful of their job. If you have a person carrying a bag and a gun, that I have a problem, first thought they're thinking of, they're going to take that away from me and I no longer have an income. So it's a very, very delicate balance. It's still in the very infancy of what we're trying to do, but it's coming. We appreciate your support. These folks in your prayers, because what you might see once in a lifetime, they see 3 or 4 times a week. With that being said, I'm done. Thank you.
And now I'd like to hear from people from some very directions, offering services here in the county and dealing every day with the people of our county, some of them being difficult sometimes, I know. But Johnny Bishop, who's here representing the Mental Health Task Force, Janice Kistler, representing the Morgan County Library, and J.C. Worley, representing the Recovery and Reentry Program.
I want to assure you I'm not Jamie Frencham. She's my supervisor, and she and both the library director are in library board meeting, which is very important. We want to keep our library going. This is one of those things that comes under the heading of other duties as assigned. But because part of my job is reference, and I sit at the information desk, which if you haven't been in the library lately, please do come, because it's halfway from one end of the building to the other, and I see it all. And there haven't been too many days that have gone by where I have not had to deal with someone who has a mental health issue. Typically, that person is homeless. And the kinds of things that I have to correct are them falling asleep. We can't have people sleeping in the library because we simply don't know if they're living or not. And we're not trained to deal with that sort of thing. And hopefully I never have to do CPR. But this is something that we have to deal with every day. We have one who swears a blue streak. We can't have that happening in the library with small children. And just a variety of different behaviors that I've seen over the years. And something has to happen in our community We have to have someone to call other than the police. They're great. They've been very helpful. They respond in a timely fashion. We appreciate them very, very much. But they aren't trained, just like us, they aren't trained to deal with mental health crises. So we do need this mental health task force. Thank you.
My name is Joni Bishop. I'm the Core Community Outreach Liaison for Morgan County. My job is paid for out of the grant from the Justice Partners Addiction Response Unit, with the goal of my job being to try to improve the communication between our local service providers and to identify gaps in services and duplication of services so that we can direct resources in the most appropriate manner. Back in June of 2021, the Better Communities Coalition developed 4 task forces. One was to address transportation, access to transportation. One was to address long-term affordable housing. One is to address short-term emergency housing. And the 4th one is the mental health task force, of which I'm a member. So I apologize for reading some of these things to you, but my memory is not what it should be. Our mission is to enable residents, service providers, and stakeholders to collaboratively assess and address the mental health needs of the community. And we envision a community where all individuals are supported and equipped to achieve mental health well-being. We have compiled a list of several things that we hope to work on together. We hope to improve Morgan County residents' mental health. We hope to create policies, systems, and environments within Morgan County that support and promote mental health well-being. We want to convene partners and stakeholders within Morgan County to systematically assess the community needs and resources. We want to build local capacity and develop and implement and evaluate a plan for mental health promotion and substance misuse prevention. At this time, we have approximately 70 members representing 40 different agencies or entities within the community. If any of you would like to participate, we would love to have you. We love new ideas, and the more people, the more ideas that we have. Our biggest project right now, or our next step forward, is to try to build capacity. As already been addressed, that we have a severe shortage of mental health workers in this community. So we need to try to bring them into Morgan County. We have an agency right now that's working to help pay off some of their student loans or pay some of their tuition if they go into this field and remain in Morgan County for an extended period of time. Thank you. I appreciate you guys.
So my name is J.C. Worley. My brother asked me to come up and speak on recovery. So I was deep in addiction for many years. And in 15 days, I will celebrate 4 years of recovery. Guys here helped me out tremendously with this program. He taught me a lot of tools to better myself. And I went to prison for Johnson County. And they have a reentry program there. And the judge is behind it 100%. He backs it 100%. And it's a really good program. And Gus, I feel like, has a program like the RSET program here. It's a lot like that. But the difference is there's not a judge that backs it. I feel like they have there in Johnson County. The judge really puts forth the effort to help people there. So, and it saved my life. I was CPM's most wanted at the time. Wow. And now I try my best to speak at events like this and tell my story. It's possible. Recovery is possible.
Yes.
I use the 12-step program, AA group. It's very possible. And there's things here that can help. And I feel like a lot of people don't know the things that we do have here. But I also feel like we need to judge the program like they have in Johnson County. That's all I got.
And I don't want to put you on the spot, and feel free to say no. Dennis Nail, I'm sorry for here. I didn't know if you would be interested in saying just a couple of words. If not, I know you weren't expecting to do this. Law enforcement is an area that I think is also important to hear the real story from.
Really wasn't prepared to say anything, but thank you. In my short career, I've dealt with quite a few different people, different characters, different backgrounds. Everybody has problems. Police officers have problems. Any public official has problems. I dealt with the issues when I come across, and I'm glad you're doing them, because we do need your assistance. Because we have nobody. When we have somebody who picks somebody up off the street, the only place we got sent was the jail. That's it. I'm sorry, that's where they get a bed and 3 hours, but that's all we can do. So you're in our body. But I must say, no program in and of itself is going to work. Please bear with me. If God Almighty is not at the center of that program, it has to be a faith-based program. I speak to you as a born-again believer. I'll stand with my Lord any day, any time, or anybody. Amen. But my job, I've got depressed, and I've got tore up over things and things I've seen and had to deal with it. But I took it to the Lord in prayer and took care of it. So with these programs, it has to be faith-based. I've talked to alcoholics that told me, Dennis, that 7-step program, if it hadn't been based on Jesus Christ or faith in God Almighty, I wouldn't have made it. So I just like to encourage you to keep going that direction. Go faith-based and go see recovery like you won't believe.
Amen.
And didn't mind saying I don't say anything else, but sometimes I can talk a long time.
Jim coming forward. I'd like to change the focus just very slightly here. Peggy Travis.
Thank you.
So we can, has been working with us in Hoosier Action. And before we move on to talking anymore, I would like to let her give a very personal aspect to this.
I'm scared to death to talk in front of people, so I want y'all to pray for me, okay? Years ago, before we had cell phones, I had a young lady call me one night, and she said that if she didn't have somebody to talk to, she was going to kill her children. The first thing I did was pray, just as hard and quick as I could pray. And I asked God to give me the words to say that thing.
Amen.
And you could hear the children screaming and crying in the background. And I asked her how she got my phone number. She just randomly picked it out and somewhere. There's people out there, like this lady, that's crying out for help. And we need to make a place for them to go to or to call. Not search a phone book for somebody to call. Also, when I worked, there was a man that had lost his baby. Shortly after losing his baby, he had lost his wife because she had divorced him. So he went home that night, and he said God spoke to him and gave him a list of people in the factory to kill. He came to work that day and come to each person, and one of them people was my setup man, and told him that God had told him to kill him. Today, in 2022, these people walks into places and tells people they need our help. They seriously need our help. Also, when I worked, there was a man who went home and his son had killed himself. 1 week after his son killed himself, his wife killed herself. Shortly after that, he killed himself. These people need help. And I hope and pray with all of my heart that all of you has come together and you find these people help. Amen. Because the world is so bad. And they really need our help. Thank you guys for listening.
And I want to thank Peggy and Ducky for opening their door. And my wife and I went knocking on and asking people questions about the community. And I just want to say, when Joni said there are a lot of organizations, there are a lot of people, there are a lot of plans, there are a lot of possibilities. And we'll talk a little bit more here, but it's fragmented. And we need to find some more effective ways to go about the work that we do. If you'd like to take just a couple of minutes while we get ready for this video to maybe catch up with those people you talked with since you take away around. This is a possible crisis response model. As Bridget was saying, much like the program she was in, and that has, and much like the program that we and Senator Bray are both going to talk a little bit about here in a minute.
Imagine for a moment that a fire breaks out in your home, and in this reality, 911 doesn't exist. You might call the fire department directly, but they're not equipped to come to your location and only put out fires at the fire station. And the only people that will come to you in the community are the police, who, though well-intentioned, are meant to provide a very different type of public service. This lack of a fire-specific response seems ridiculous, right? Of course we should have targeted services to respond to life-threatening emergencies, whether that's fire, law enforcement, or physical health. However, in many communities across America, life-threatening mental health and substance use crises are treated as an afterthought, receiving a response that's not specific to their unique needs. A 911 call dispatches the police, who most often bring the patient to a medical emergency room or jail, or allow them to remain in the community but without assessment, treatment, or support. We have a patchwork system, made up of elements designed for other purposes, that doesn't have the capacity to treat the most vulnerable in our communities, even though an estimated 20 to 25,000 individuals in crisis go to emergency departments every day in the U.S. So how can we improve? The only solution to delivering crisis care worthy of our communities is to build a structure specifically for mental health, substance use, and suicidal crisis that is on par with other emergency systems like we do for medical, fire, and law enforcement. By integrating 3 core elements, we can replace the patchwork fabric of our crisis care and develop a true safety net that can serve everyone, everywhere, every time. And in the process, we can reallocate wasted financial resources to places where they can have a deep community impact. It starts with regional or statewide crisis call hubs. Call, text, and chat lines staffed by trained professionals who answer the call every time and direct people to the level of care they need. The onset of 988 is a great start. However, it will need to be supported by technology that empowers 988 to become an air traffic control for mental health and substance use crisis, enabling real-time coordination across the care spectrum. But a comprehensive crisis network cannot be built with only crisis call hubs. Additional services are necessary to ensure that a unified system of care is available when and how people need it. Services like mobile crisis outreach teams, 24/7 non-law enforcement mobile teams that go out in the community and deliver care to people wherever they are. This lessens the burden on law enforcement during situations where they're not needed and eliminates the anxiety people feel when a uniformed officer knocks on their door. And facility-based crisis receiving and short-term stabilization, facilities that say yes to every person that walks through the door, regardless of their level of need, allowing them to bypass the medical emergency departments. This not only provides specialized care to these individuals with less waiting, it also enables medical emergency departments to focus on the patients they're trained to serve, while drastically reducing wall time for police when transportation by police is warranted. With these core elements in place, mental and substance use healthcare can move out of the shadows and into the mainstream. Together, we can build an unbroken system of care that connects patients from the point of crisis to the level of care that's right for them. To learn more, visit crisisnow.com.
And once again, that is one possible model. As I mentioned a few times in September, the Indiana Behavioral Health Commission issued their final report from their work as a task force on the problems of mental health in Indiana. It was, this task force represented officials from the courts, the legislature, state agencies, law enforcement, along with mental health professionals, business leaders, and members of the recovery community, among others. The model of someone to call, someone to respond, and a safe place for help, connected by a state infrastructure, comes from their recommendations. This would involve the 988 mental health suicide call line, with call centers much like the current 911 line, mobile crisis response teams and regional treatment centers, as well as enhanced and more fully staffed counseling services throughout the state. And the enhanced mental health certification, I think, is something that has been coming for a long time, as people see the need. The bottom line focuses on good crisis care to prevent suicide, and provide help for distressed individuals. It cuts the cost of care, reduces the need for psychiatric acute care, hospital emergency department visits, and police overuse, letting them do their job, which is vital, which is crucial, which needs to be done, but we don't need to be overburdening them. And it's estimated that untreated mental illness and substance abuse is costing the state, according to this study from this task force, $4.2 billion. Those costs are both direct and indirect, but they're very real and they come out of our state's economy and out of your pockets and everyone else's pockets. The suggestions as the task force wrote them for a care model was estimated to cost about $130 million annually. For comparison, Arizona has been running a similar program. They have about 300,000 more people than Indiana, but very close in size, and it's been costing about $159 million annually to run that. There are a lot of moving pieces, as we've said. It has to be, this is going to, it may not happen in every county, but the more counties that it happens in, the more successes we're going to be able to look at and duplicate. What works in one place might work somewhere else. I know that Huntington area, St. Joseph County, I've heard about a jail-based pod program with a separate recovery pod in Kendrick County, Kentucky, that's supposed to be very good. There are places that people here can go and look at things other people are doing, but it's going to take all of us in one way or another. And now we have these kind people who have so patiently sat here.
Well, thank you. Okay, I'm going to invite David and Rachel up, and we're going to hear from our elected officials. Thank you all so much for being here. I will just note before I hand it over to y'all, there are answers on your tables. We're a little behind on time, so I don't know how much time we'll have for questions. This is really informal, so if you'll get a question and you're like, I don't know, you can pass. But if you have questions for elected officials or anyone else who has spoken today, you can write it on an index card, hold it up, and our team will come grab it, and we'll try to get to as many as we can. You guys are close to me because I've seen the destruction it can do to our rural communities. Too many friends and family members have suffered, and we need to take action. 2 years ago, I opened a yoga studio in Martinsville during the COVID pandemic because I figured that's a really good time to do that. However, since opening, the need for connection and a safe place to heal was apparent. I'm here with all of you this evening to hopefully create change so our community can heal and thrive. So I'm going to take this time now to introduce Senator Rod Bray and give him a chance to speak to all of us tonight about this topic.
Rachel, thanks very much for the introduction, and all of you from Hoosier Action, thanks for your efforts to put this together tonight. This is a great opportunity to get here to talk and figure out how we can best be helpful here. And what I thought I could talk a little bit about are some of the things that are going on in the state of Indiana right now. Is what I'm feeling is, frankly, some fantastic synergy across the state about what we're doing. And just last week, last Friday, in fact, there was a big meeting up in Indianapolis that the Indiana Supreme Court put together. And you had members of the Supreme Court, Court of Appeals, as well as judges from across the state of Indiana. You had the governor that was there, myself as part of the Senate, Speaker of the House, and lots of other senators and House of Representatives folks. They were talking about what the state of Indiana needs to do to help in this crisis. And Melissa Greene was there as well. And in fact, more than 1,000 people, judges and elected officials and service providers and information officers and CEOs of companies and hospitals were there to talk about this exact topic just last Friday. And so I think that the Supreme Court is extremely interested in it. The governor spoke and is extremely interested in making sure that we can be helpful, as well as the General Assembly. And as we come towards January, when a new General Assembly session begins, this is frankly going to be one of the hot topics. We'll talk a little bit about some of the ideas that are floating around. They came from that task force that you mentioned, and some of the other ideas, because I think there are things that the state of Indiana can do to be helpful. Part of that is money and resources, obviously, and part of it is some changes in the statutory structure that we have today. So I'll talk a little bit about those, and then I'll make a final point as well. And of course, happy to take as many questions as you have tonight, because I'm just pleased to be here. One of the things we talked about here a few minutes ago was the 988 line, and that is up and running now, but it has a long way to go. So the fact that it's up and going is not nearly enough, I don't think. First of all, the 988 line doesn't do a good, and Steve, you could probably talk more about this than I, but it doesn't do a good job of sharing back and forth with information that comes in from the 911 line. We've got a technology and just some effort that needs to come together to help so that information kind of flows freely back and forth, because right now it's not doing that. In addition, it seems like one of the best practices is that we call 988, and somebody that answers the phone is trained in how to handle mental health issues. And they can maybe talk to that person and provide some service. And then if they recognize that, my goodness, somebody needs to come on site, then they can dispatch that person, just like 911 would dispatch Steve or the police department or the fire department or whoever might be necessary. And they can go out and provide services to that person. And then if it was necessary, then they would have a facility to take that person to as well. And as you know, we don't have any of that infrastructure in place right now, but it seems like a really good direction to go. And I think you'll see the state of Indiana try to go that way. Now, as you all know, finances and funds are a finite resource and very difficult to do, and that is extremely important. Don Adams, the county commissioner, And over the last few years have rolled out kind of a county-wide 911 system that is working really well right now. But it's been expensive for the county to do that because it doesn't fund itself. And so the county has to find those resources and the state has to find those resources. So we'll work on that. A couple of other things that are happening in the state right now are twofold. One, the public health task force came back with its work, and it's sort of interesting. The former Senator Luke Kinley used to run the appropriations committee for the Indiana Senate, and he was always the one who guarded the dollars and the finances very, very carefully. And Indiana's famously been very fiscally prudent, and I'm very, very proud of that. But so Senator Kinley looked at this public health infrastructure that we have right now, and we've all known for some time that it's not adequately funded. And some of those metrics, Indiana ranks in some of the bottom of some of those metrics, in fact. And one of the reasons why is that the public health infrastructure really has been left to be funded by local government. And local government has lots of needs. You have to make sure the roads are paved and all the infrastructure. And there's 1,000 things that they have to do, and the correction system that they have to fund. And so they just have priorities that probably require them to spend those dollars on that rather than the public health. And so we're going to try and begin to pivot that and be provide more assistance at the state level. Now, the number that they came back this year, which is so astounding when it comes from Senator Kinley, who used to kind of guard the budget very closely, was to the tune of about $240 million a year. That's $500 million in our 2-year biannual budget. I don't know that we can get there just this time with that, because that is like a really large sum of money to step into, but it is starting the conversation so that we can begin to more adequately fund those public health metrics. And so we'll see where exactly that goes in this next legislative session, but I can tell you we're going to put a lot of work into that. Another thing we're going to work on, and I think the bill is going to primarily come from the House of Representatives, Greene, who's one of the more effective representatives that we have, either the state, or the Senate, or the House from Hendricks County. And he has been working for months on ways to to take the people that are in our jails, our local county jails, and get them a different kind of help they need rather than just the criminal corrections help. I think the statistic that I hear all the time, and I completely agree with, is about 70% of the people that are in our local jails have either mental health or drug or alcohol addiction. 70% of those people. And so they're just not being cared for in the right way in those jails. And that is not a criticism of the jailers, and it's not a criticism of the county sheriff. That is not what they are equipped to do. And so trying to find ways, avenues for the judges to identify those folks and pull them out of the jails and send them to a different facility where they can get the help they need is going to be part and parcel and paramount to the job that Representative Sturwald is working on right now. So there are a lot of ideas that we're working on that we can try to be helpful with. But I guess this is, if you take anything away from what I say this evening, I guess it's this. The state can do a lot of things to help shift some money around and devote to this kind of a project, and even provide some infrastructure for that funding. But there isn't anything the state's going to do that's going to be more effective than the things that you're all going to do here in this room. For the people that we've heard talk up here from Hoosier Action, who's kind of spreading the word and trying to land on a policy for Morgan County. If you look around, we have 92 counties and thousands of cities and towns across the state of Indiana, and everybody, I hope, many of them, are working on this project. And Huntington County was mentioned, Valparaiso, and Porter County is one of those that has a wing of their county jail to work on the addiction and mental health issues specifically. And they're trying to put together a system where they regionally people can send them to that facility. So we need to make sure that we're looking across the state of Indiana and figure out, all right, somebody's doing it right. Let's not reinvent that wheel. Let's follow that. Let's share that information so we can follow that and be as helpful as we can. Last thing, I was just down in Lexington, Kentucky for some meetings with some other legislators across the country just 2 weeks ago. And again, mental health and addiction was a huge part of that conversation. And an organization got up and talked, and one lady that works for that organization now was initially a beneficiary of it, called Volunteers of America. And they, at least this program, talked specifically about women and trying to help women. They identified that one of the reasons that women are less likely to come forward to get help is because inevitably they have children that are in their lives, and they're not going to go do something that's going to separate them from their children. Either going to put themselves in jail or put themselves in a facility where those children can't follow them. And Volunteers of America recognized that and decided, come on, bring your kids with you. We want all of you. And they bring that synergy together, and they can begin to heal themselves with their children there. And there are other women in the same facility that begin to learn and share and grow together. And frankly, it was inspiring. So there's lots of ways. There's not one way to get ourselves to help in this project. There's lots of ways to do it. And everybody getting together today in this room is a fantastic way to get that started here in our community. So I want to thank you for being here. I want to thank you for the work that you're doing and the interest that you have. And I want to thank you for inviting me, because I'm here primarily to listen and learn, and happy to answer any questions you may have. But thank you very much. Is now the time for questions? Somebody tell me if I'm happy to take them, or if you have other people to talk, and then we can take questions. Somebody tell me what's the begin.
We were gonna wait just a little bit, kind of do it all at once.
Yeah, that sounds fine.
We're gonna get some, pass out some cards in just a bit, and I click the cards, we'll have some questions that way. I introduce myself. My name is David Shell. I grew up here in Martinsville. I was a little tyke on a bike, delivering paper routes up and down all these alleys back in the 50s and 60s. And I liked it here. I did go away for a while, but I came back. I'm glad I did. I went to vacation Bible school right here in this building, right in the room back there. They gave me my first Testament. I didn't much know what it was at the time. But I found out as life went on, it was a wonderful resource for my own mental health. I grew up in a large family. I don't need a mic probably because I had 7 sisters. If I was going to be heard, I had to be talked about. Anyway, I'd just like to take a moment to thank all of you for being here tonight. There's a lot of other things we're doing now, but we have something in common. We really care about other people. And that's why we're here tonight, because we want to make a difference, and we care. So we're the perfect people to be here tonight, and I'm glad you're all here. Thank you. I'm going to move this way and introduce you to Mr. Don Adams. He is the county commissioner here in Morgan County. And we had a meeting with him on that, and one thing we realized is he's probably never short of words, and that he really cares about other people. And that's a wonderful thing, Don.
Well, thank you. I'm one of the 3 commissioners, so you can, it's not like having a mayor, it's like having a board for your county. And I don't spend any money without the county council's approval. They're the money people. We work together. And of course, Senator Bray said everything that needs to be said. I couldn't compliment him or add much to what he has to say. I will say that I'm going to be back because of Roxy's cookies. They are wonderful, and I didn't realize you did this so frequently, so I'll return and listen to what you folks have to say. I want to mention just one thing, and it's a reflection upon, first of all, appreciation would be the first thing I need to say. I've learned a great deal. I'm here to learn, and you've been a great teacher. Some of the folks that spoke have been booming. We have the
county auditor, or the county coroner made a report 3 weeks ago on the third quarter in Morgan County, his work. Probably sort of shocking. You saw it once here, but in the third quarter, that would be from July through September, we had 6 suicides and 18 overdoses. That's 18 people. That's 18 overdoses. 12 overdoses and 6. We had 18 folks that left this county, left this life because of probably most of the time mental health issues. If I had if we had that same number, we had one automobile accident and 4 dear friends, actually. But if we had 18 deaths on our county highways, imagine the furor that would be raised. We're aware of it, but we're really kind of ignoring it. And I think that's changing. And I look forward to working with the Hoosier Action and work with the state. We're going to be making it's very promising to see some attention at the highest levels, judicial, governmental. Lieutenant Governor Crouch is one of the great leaders in that as well. And Morgan County will be right in there with it. And I'm sure that County Council, we have a lot of other things to tend to. Our garden's got a lot of things growing. And we have to make sure everything gets its share of fertilizer. In that case, in Morgan County, has money. And the lady to my left is on the County Council, and they're the guardians of your tax dollars. We just bring the good ideas and hope that they understand it and can manage it. So I'm going to let her speak to us. She's been very involved and also been eating some of my cookies. So.
Yes. Thank you so much. It's nice to see so many people show up for an event like this. I'm pleasantly surprised. And just a couple of things that I wanted to talk about. I had the privilege and honor to be a part of the Indiana Mental Health Summit on Friday that Senator Bray is referring to. And I just want to tell you that change is brewing, okay? And with you all here, that's the first place it's going to start in our county, right? Just awareness. And I just want you to know that on a state level, we're looking at doing some things differently. They're looking at changing the traditional community mental health model to a certified community behavioral health model. It's a little different. The funding's a little different. I know that with Centerville, they're our mental health provider in this county. And it's hard to staff Centerstone, right? It's hard to get employees and providers to come into this county. I think that was mentioned earlier too. And so I think maybe with a different model, we can increase pay. And that can be, right, and that's definitely a place, I mean, it's a hard job. The burnout rate in mental health for mental health providers is extremely high. It's not an easy job to go to every single day. So I think if we do that, that would be good. And I had a couple of notes. So as I alluded, change starts with the folks who are taking action, you all. But then what you have to do is you have to stick with it and you have to pull it through, right? You have to stay by it. And you know, it's going to evolve. What you think is going to happen today, next year, it might not, but over the course of the year, you'll hone it to find something better. Rod alluded to this. There are other counties and other states that do it better. Arizona is a great example. There's actually a model out of Arizona where first responders they go through a class to learn how to respond to a mental emotional call, right? I've been in a situation with a family member that I saw how this unfolded. My husband's a fireman, and he called and said, hey,
Can we have people show up without lights and sirens? Can we only have one vehicle? It doesn't work that way. Dispatch has to send so many people because of the situation, right? And that escalates the problem often. So Michaela, I'm so excited that you are doing the training that you're doing and you're going to be providing your services in Morgan and Owen County, because that's definitely something that we need, a field social worker. And then maybe if we could train our first responders to just deal with this kind of situation, you know, the right words, you know, taking off maybe a uniform out or something to just de-escalate the situation. So I think we're headed in the right direction. And I believe that the answer to all of this does lie in continuity of care, having the resources and connecting people to those resources. I met some ladies at a table tonight that, you know, I've never met. I know what they do, I know what their services are, but how do we get the people who need those services to them? How do we get that out there? I'm super excited about 988. Is it live? Like if someone called 988. Okay, so there's that. Did you all know that? It used to be a really long 10-digit number, right? And now it's 988. So if you have someone in crisis, remember that number. Now, that's going to evolve too, and that is going to take money. But those things are there. There are other resources. There are foundations. There are grants. There are, you know, there are money in different buckets of money in the county that might be applicable to helping implement a better 988 system. So I want you to just have hope, right? And let's see, I think that basically covers everything. So we just need to help people connect the dots. And we need to be there at their moment of need. And we need to respond to their need the way they need us to respond. So I think that's all I have to say, but I applaud what everyone's doing, and I appreciate you letting me come in tonight.
Okay, just because of time, we're gonna skip the questions. We apologize, but I think that we'll still collect them and follow up with whoever wrote the question. Okay, or I guess they're willing to stay if you want to approach them afterward. That would be awesome. So, and then we're gonna bring us Mary Ann. A second.
That happens to me a lot. My name's Mary Ann Shell. I've been with Hoosier Action almost 4 years now. And this issue that we have is so very important to all of us, but especially to me. This person is Robert Shell. He is my nephew, and I loved him with all my heart. He had a substance use disorder, and he called me a couple of weeks before he passed. He said, "Auntie," he said, "can I come and stay with you a couple of weeks?" Well, he didn't explain why. I knew he had substance issues, and I talked to my husband, and he said no, and I said no. And his mother's sister was supplying him with drugs, and she supplied him with fentanyl, and Robert overdosed and died. And it broke my heart. We all have issues like this in our family, where things break our hearts. We need to do something about it, and I can't do it by myself. I would love to wave a magic wand and have all mental illness disappear, but it's not going to. I can't do it, but we can do it as a community. We can do it as elected officials. We need to be able to do it because we can't stand alone. I have this commitment card, and each of you have one of these commitment cards. Yes, it should be in your little packet that you guys got. I hope that the elected officials got one too. And I will read through it. We would like you to check one of these boxes if you can. I will work to get word out about this issue by talking with friends, family about this issue. We need to get it out in the open. We need to make sure that there's no stigma attached to mental health anymore. We need people talking about it. So maybe you don't want to talk to friends and family about it. Maybe you'd like to knock on doors with us, and we would love that. You can share posting on social media about this issue that we have. Just check one of the boxes. One of it is, I will attend the next Hoosier Action meeting on November the 2nd. Thank you. I didn't have that written on my paper. We want to work out a solution, and the way to help is have the community help us work out the solution by coming to a Hoosier Action meeting. It'll be at St. Mary's, correct? Property. Or it's on Morgan Street, home in Morgan. Oh, okay. Yes, the place. You might check the box that says, I want to attend a mental health first aid course. And this first aid course is to help us recognize people in crisis and how to help them. There is an online class that I discovered today that we can take and be accredited on being the mental health first aid course. So all you have to do is Google it. You can take, you can receive a credit for it. So think about it. You might want to do that. I want to meet other people about this issue. Like, we go and talk to the sheriff. We go and talk to other people that have total issues on this. Senator Stowe, if you want to join us, just say the word. And the last box is, I will become a dues-paying member of Hoosier Action. We cannot do this. Most of us are volunteers, but there are some people in the hierarchy that are paid. We also pay for different things out of the budget. We go to the state house and have to pay for parking, things like that come out of the nonprofit part of it. So if you wanted to become a member, if you just wanted to make a contribution tonight, Tasha, who you met earlier, is the person to talk to. She will help you. We would love for you to put your name, phone number, and address on the commitment card also. And we just want to follow up with you. So I hope that you can fill out the card, and please, when you fill it out, raise it up. And somebody will be there to pick it up for you. Thank you.
Good seeing you, Dennis. Take care, buddy. Always good to see you. Man, you take care.
Yes. So, if we could just take a moment here just to come into a place of stillness, maybe look across the table at the people sitting next to you. Hello. And good job.
That's good. Yes. That's Becky. Are you loving
Alright, so I have a poem tonight. I did not write
You didn't have that many names though, right? Just 2 or 3?
words, but it represents for preservation.
We're gonna need to get organized and live beyond boundaries. Soften our hearts, talk to each other. We're gonna need to leave behind our baggage, relinquish our comfort, release our control, and coexist. We're gonna need to give up our addictions, confront our pain, ask for help, give more than we take. We're gonna need to dream bigger, work harder, get dirty, take time. We're gonna need to remember. We're gonna need to forgive. We're gonna need to let go. We're gonna need to let go. We're gonna need to feel fully, revive our intuition, make up our minds, enact change. We're gonna need to look at ourselves, reconcile our ignorance, sacrifice shame, make amends, peel away the non-essential, break a sweat. We're gonna need to heal our fears, tell our secrets, share with our enemies, and love ourselves. We're gonna need to study existence, refine our dreams, mediate our shadows, and cure our disbelief. We're gonna need to practice magic, and we're gonna need to cherish water. We're gonna need to grieve. We're gonna need to move on. We're gonna need to stay focused. We're gonna need to be strong. Tend our commitment to beauty. Fuel our devotion to truth. We're gonna need to pray. We're gonna need to follow through. Endure burning. We're gonna need to surrender. We're gonna need to trust. We're gonna need to give light. We're gonna give light because we are light. So, thank you all for coming. Thank you, elected officials, for being here. We can give them a big. It's 30. What time is it? You're right. 7 o'clock. If you have questions for officials,